right now, while you're watching this, there is something happening inside millions of seniors across America that has absolutely no pain attached to it. No dizziness, no chest tightness, nothing that would make you put down your coffee and call your doctor. And yet, it is quietly raising the risk of stroke and heart damage in people who are doing everything they think is right. People who exercise, people who eat carefully, people who take their supplements every single morning because they want to protect themselves. And one of those supplements, one of the most trusted ones on the shelf, is the exact thing creating the danger when it meets the wrong medication. If you take vitamin B12 every single morning, stop and watch this before you take your next dose. Because as a cardiologist, I have seen this exact combination quietly damage hearts and raise stroke risk in people who are doing everything right. Stay with me for the next few minutes, because what I am about to show you is something most people over 60 have never heard from anyone. My name is Dr. Ben Walker. As a cardiologist, I have spent the last 20 years working with seniors in clinical cardiology. In that time, I have seen thousands of patients who were doing the right things on paper, taking their B12, managing their blood sugar, watching their blood pressure, and still ending up in my office after a TIA or a minor stroke or a cardiac event that came out of nowhere. And when I started looking at what these patients had in common, I kept coming back to the same combination, vitamin B12, and one of two medications that are in the medicine cabinets of more than half the people watching this right now. In the next several minutes, I am going to show you exactly which two medications are dangerous to combine with high-dose B12 after the age of 60. I'm going to explain what happens inside your body when you take them together. And I am going to show you how to protect yourself starting today. Before I go any further, I want to ask you one thing. Type your age in the comments right now. Just your age, because what I am about to share hits differently, depending on how long you have been taking these medications, and I want to understand who is in this room with me today. Now, here is something worth knowing before we go deeper. A study published in the Journal of the American Medical Association found that seniors who took high-dose B vitamins, including B12, over an extended period actually showed increased cardiovascular risk under certain conditions compared to those on lower doses. Not decreased, increased. That finding stunned a lot of people in my field. But when you understand the mechanism, it makes complete sense. And that mechanism is exactly what I want to walk you through today. But first, I want to tell you about Dorothy. Dorothy was 71 years old when her daughter first brought her into my clinic. She was sharp as a tack, retired school teacher. She walked every morning. She took a handful of supplements every day with her breakfast because she had read that after 60, the body stops absorbing nutrients the way it used to. B12 was at the top of that list. Her previous doctor had mentioned LOI 12 years ago, and she had been supplementing ever since. She was proud of it. She told me she felt like she was being proactive. What Dorothy did not know was that she had been on Metformin for type 2 diabetes for nearly 8 years. And for 8 years, nobody had ever sat down with her and explained what Metformin does to B12 absorption over time or what happens when the body tries to compensate. Her daughter noticed that Dorothy had been getting more tired than usual over the past several months. Not sleepy, tired, just drained in a way that sleep did not fix. Dorothy told herself it was age. She told herself 60 was different from 70, and 71 was different again. She explained it away every single morning. When I pulled her full blood work, including her homocysteine level, I found what I had started to expect. Her homocysteine was dangerously elevated. Her B12 levels were actually high from supplementing. But the two things together told a story that neither number could tell alone. And the story was one of silent vascular damage that had been building for years while Dorothy did everything she thought was right. We changed her approach that afternoon, but her story made me want to reach every senior I could before they ended up in the same place. So let me explain exactly what is happening inside the body and why the combination of B12 and these two medications creates a problem that standard checkups almost never catch. The first medication I want to talk about is Metformin. If you have type 2 diabetes, there is a very good chance you are on it. It is one of the most prescribed medications in America, and it has been for decades for controlling blood sugar. It is genuinely effective. But Metformin has a side effect that most patients are never clearly told about, and it is this. Over time, and especially over years, Metformin interferes with something called intrinsic factor in your gut. Intrinsic factor is a protein your stomach produces that acts like a delivery vehicle for B12. Think of it like a taxi. B12 gets into the taxi, and the taxi drives it to where it needs to go in your bloodstream. Metformin quietly damages that taxi system. It makes it less reliable, less consistent. So your doctor sees low B12 levels and says take a supplement. And you do. You go out and buy a high-dose B12 tablet because more feels like better. And for a while, your blood levels of B12 go up. And your doctor says everything looks fine. But here is what that blood level is not showing you. It is not showing you what is happening downstream. Because when B12 cannot be properly processed and transported due to the damaged intrinsic factor system, it begins to interact with another molecule in your blood called homocysteine. And homocysteine is where things get genuinely dangerous. Homocysteine is an amino acid your body produces naturally. In small amounts, it is harmless. Your body uses B vitamins, including B12, B6, and folate to convert it into something useful and clear it from your bloodstream. But when that conversion process is disrupted because the B12 is not being properly absorbed or processed, homocysteine builds up, and elevated homocysteine in the blood does something very specific and very damaging. It acts like sandpaper on the inside walls of your arteries. A research team at Harvard Medical School described it this way. Elevated homocysteine does not cause a sudden blockage the way a clot does. It causes chronic abrasion. It inflames the arterial wall. It makes it stiff. It makes it easier for plaques to form and harder for the vessel to expand and contract the way a healthy artery should. Think of your arteries like a flexible rubber hose. When they are healthy, they stretch and rebound with each heartbeat. When homocysteine has been scraping those walls for months or years, the hose becomes more like a rigid plastic pipe. And rigid pipes crack. They do not flex under pressure. They break. In the cardiovascular system, a break like that is a stroke or a cardiac event. How many of you have been on metformin for more than 3 years and also taking B12 supplements? Be honest with yourself right now, because the combination I just described is happening in people's bodies every single day, and almost nobody is connecting the dots. Now, I want you to hold on to everything I just explained, because what comes next connects directly to it. The second medication I need to tell you about is one that even more people are taking, and its interaction with B12 is different from metformin, but in some ways even more unpredictable. Harold was 67 when he retired from his job at a paper mill in Ohio. He was a big man, quiet, the kind of man who did not complain. His wife, Patricia, told me that he had been having what she called off days for about 6 months before his stroke. Days where he seemed slower, where he would start a sentence and lose track of it halfway through. Harold told her it was just the adjustment to retirement, his brain getting used to a slower pace. He was on a proton pump inhibitor for chronic acid reflux. He had been for 11 years, and like Dorothy, he had started taking B12 because his last doctor had told him his levels were on the low end. Harold had a stroke on a Tuesday morning. He was in the kitchen making eggs. Patricia found him sitting on the floor with his hand pressed against the counter like he was trying to steady himself. He was conscious. He could speak, but one side of his face was drooping, and he knew something had happened. The ambulance came. He survived, but Harold spent 3 months in rehabilitation relearning how to hold a pen. He was 67 years old. His doctors told him his arteries were in worse shape than expected for his age. What nobody told him was why. When I reviewed cases like Harold's, I kept seeing the same pattern. Proton pump inhibitors, commonly known as PPIs. These are medications like Omeprazole and pantoprazole that reduce stomach acid. They are prescribed for reflux, acid damage, and ulcer protection. And they are extraordinarily common among seniors because acid reflux becomes more frequent after 60 as the digestive system changes. But PPIs do something that most people never hear about at the pharmacy counter. They reduce the stomach acid that is necessary to release B12 from food in the first place. Your body needs an acidic environment to break down the protein bonds that hold B12 in food. When you reduce that acid with a PPI over months and years, your dietary B12 absorption drops significantly. A study published in the Annals of Internal Medicine followed over 25,000 patients on long-term PPI therapy and found that after 2 years of continuous use PPI, patients showed measurably lower serum B12 levels. After that finding, what do most doctors do? They recommend a B12 supplement, which makes sense on the surface. The problem is that in certain individuals, especially older adults with reduced kidney function, the B12 supplement is not processed and cleared efficiently. It accumulates in the blood in a form that interacts poorly with the homocysteine cycle we just talked about. But here's the part that stopped me cold when I first saw it in the research. Some patients on long-term PPI therapy develop something called rebound acid hypersecretion. This means that when they stop the medication, or even when the medication is metabolized overnight, the stomach overproduces acid in a kind of compensation response. During that rebound window, the high-dose B12 supplement is being processed in an unpredictable environment. The absorption becomes erratic, and erratic absorption means erratic homocysteine management. Some days the system clears it, some days it does not. When was the last time your doctor asked you specifically whether you were on a PPI and also taking B12 at the same time? Type never in the comments if the answer is never. I want to see that number because I think it is going to be sobering. Now, here is where everything we have covered comes together. The homocysteine connection is the heart of this entire issue, and I want to make sure you fully understand it before we talk about what to do. Homocysteine is one of those numbers that almost never shows up on a standard blood panel. Your doctor checks your cholesterol, your blood sugar, your thyroid, maybe your B12 level itself. But homocysteine requires a separate test, and it has to be specifically ordered. The Cleveland Clinic has called elevated homocysteine a significant and underrecognized risk factor for cardiovascular disease in adults over 60. Yet most seniors have never had it tested in their lives. Here's why that matters so much. When your homocysteine levels stay elevated over a period of months and years, three things happen inside your cardiovascular system. First, the inner lining of your arteries becomes inflamed and begins to lose its natural smoothness. Second, small oxidized particles of LDL cholesterol find it easier to embed in those inflamed walls and form plaques. Third, the plaques that form in an inflamed high homocysteine environment are more likely to rupture unstably, meaning they break off and travel in the bloodstream rather than sitting in place. That last point is the one that explains strokes in people who have no major blockages on imaging. The plaque was there. It was unstable and it broke loose. Doctors see this pattern and call it cryptogenic stroke, meaning a stroke without a clear identifiable cause. But researchers at the Mayo Clinic have found that elevated homocysteine is present in a disproportionate number of these so-called unexplained strokes. The cause was not mysterious. The right test was never ordered. This is not meant to frighten you without purpose. This is meant to give you the knowledge that puts the power back in your hands. And now that you understand what is happening inside the body, let me tell you what you can actually do about it. The answer is not to stop taking B12 entirely. B12 is genuinely essential, especially after 60. Deficiency causes nerve damage, fatigue, cognitive decline, and yes, cardiovascular risk of its own. The goal is not less B12. The goal is smarter B12. First, if you are on Metformin, the most important thing you can do right now is ask your doctor to test your homocysteine level and your active B12 level. Not just total B12 in the blood. Active B12, there is a difference. Total B12 can look normal, while active B12, the form your body actually uses, is low. This distinction is critical, and it is a distinction many standard tests miss. Second, the form of B12 matters enormously. Most supplements on store shelves contain cyanocobalamin. It is the cheapest form to manufacture, and it requires your body to do several conversion steps before it can be used. For older adults on metformin or PPIs, those conversion steps are often compromised. The form called methylcobalamin bypasses most of those steps. It is already in an active usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin raised functional B12 levels more reliably in older adults than cyanocobalamin at equivalent doses. Third, the dose matters more than most people realize. High-dose B12 supplements in the range of 1,000 to 5,000 micrograms daily are commonly sold and commonly taken. But the body can only absorb a small fraction of that through passive diffusion without intrinsic factor. The rest floods the blood in a form that may drive the homocysteine imbalance we talked about. A more targeted dose of 250 to 500 micrograms in methylcobalamin form taken with AB6 and folate combination gives the homocysteine cycle everything it needs to function properly without overwhelming the system. Fourth, talk to your doctor specifically about your medication list in relation to your supplements. Bring this to your next appointment as a specific agenda item, not as a passing question, as the main topic. Say, I want to discuss my B12 supplementation in relation to the medications I am on. That conversation alone could change the trajectory of your cardiovascular health in ways that nothing else will. Now, I want to tell you about Beverly because her story is the one I want you to carry with you when this video ends. Beverly was 74 years old, and she had been on a PPI for 14 years and supplementing with B12 for the last 5 of those years. She came to me not because of a health crisis, but because her daughter had watched a video online about homocysteine and heart health and had dragged her mother to my office with a printed article in her hand. Beverly was skeptical. She felt fine. Her blood pressure was managed. She walked her dogs every day. She was not the kind of woman who worried. Her homocysteine came back at 31 micromoles per liter. The safe range is below 15. At 31, she had more than double the level associated with significantly elevated stroke risk. And yet, she had no symptoms, no warning, no clue, just a number on a page that explained exactly why her arteries were working harder than they should have been for the past several years. We changed her supplement form to methylcobalamin. We added a low-dose B6 and folate supplement to support the homocysteine conversion pathway. We timed her B12 away from her PPI dose to maximize absorption during the window when her stomach acid was most active. And we scheduled a follow-up homocysteine test for 90 days later. When Beverly came back 3 months later, her homocysteine had dropped to 17. Not perfect yet, but moving in exactly the right direction. She walked into my office that day looking lighter somehow. She told me she did not realize how tired she had felt until she started feeling less tired. She hugged her daughter in the waiting room before they left. That is what the right information at the right time can do for a person. If you have been doing any of this for years, it is not too late. The body has a remarkable ability to recover and rebalance when you give it what it actually needs. The vascular inflammation that homocysteine causes is not permanent when caught before a major event. The damage can slow, the numbers can move. Beverly proved that in 90 days. What you have learned today is this. Metformin and B12 create a dangerous interaction through the intrinsic factor pathway that leads to elevated homocysteine and arterial damage over time. Proton pump inhibitors reduce the acid environment needed for B12 absorption, and in long-term users create an erratic processing environment that disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard panel, and elevated levels in seniors are a significant underrecognized cause of stroke and cardiovascular events. The fix is not stopping B12, but switching to methylcobalamin at a smarter dose with B6 and folate support, and having a specific conversation with your doctor about your full medication and supplement picture. You now know something that most people watching this have never been told, and that knowledge belongs to the people you love, too. If you want honest health information like this every single week, hit subscribe right now because every single week I share what your doctor simply does not have time to tell you in a 15-minute appointment. And make sure you tap that bell icon so you never miss a new video. If this helped you today, hit the like button because it helps other seniors find this information before it is too late. Type the word protected in the comments right now if you are making this change today. And think of one person right now, your partner, your sibling, your closest friend. Send them this video today, not tomorrow. Today. You may never know whose life you just changed. I am Dr. Ben Walker. Take care of your heart. I will see you in the next one. Next week, I am covering something that almost every senior with high blood pressure is doing wrong at the pharmacy that is making their medication less effective. You will not want to miss that.